If you're gonna be a public-facing medical professional that goes on to talk about COVID-19 and say that you're talking about science, at least do it accurately and keep the politics out of it. Let me explain why the information these doctors presented is just not scientifically accurate. Look, the fact that they tested 5,000 patients in their urgent care centers and 6% of them tested positive for COVID-19 makes a lot of sense. And it's actually probably accurate. But what's not accurate and what doesn't make sense is to then take 6%, that number, and assume that if you test all of New York State or all of California, then 6% of those people will also test positive. That's just not how statistics work. The people that go to an urgent care center are more likely to test positive because they're showing symptoms, because they likely had exposure to COVID-19. That's why they're there. In general, when you're testing a pre-selected population like that, you're gonna have higher numbers. It's like assuming that if you go to Southern California and gather the weather data, you can then extrapolate it and assume that the weather is the same in New York. And then, with the incorrect assumption that 6% of the general public must be COVID positive, they go on to calculate a fatality rate that's similar to the flu. Let me go ahead and explain to you how we calculate a death rate so it all makes sense. First, we take all the people who've died with COVID-19 and we divide that number by all the people who've been infected with COVID-19. Let's run an example here. If 10 people have died of COVID-19 and 1,000 have been infected, you divide 10 by 1,000 and you get 1%. That makes a 1% death rate. Now, if you incorrectly assume that way more people have had COVID-19 than is true, you can artificially lower this death rate. My second issue is, let's go ahead and assume their calculations are correct. They're not. It doesn't change the fact that COVID-19 is still much more dangerous than the flu. Reason being that COVID-19 spreads at a 2 to 3 times faster rate than the flu, which means that it can overwhelm our hospital systems in the blink of an eye. In fact, that's what the purpose of all these lockdowns were, to ease the strain on our hospital systems so we can continue taking care of patients that are not only suffering with COVID, but with all the other medical ailments out there. If you would have been in a car accident, there would have been no one to help you. If you call for a heart attack, there would have been no one to help you. We must also remember that for the flu, we have a vaccine. We have an FDA-approved treatment. So by maintaining the lockdown for a slightly longer period of time, we're buying time in order to get there, to get the vaccine and to get the treatments authorized. These are all the reasons why I've been consistently saying on my YouTube channel to my patients on television that while COVID-19 looks similar to the flu, to virus, upper respiratory symptoms, they are not the same. They are fundamentally different in that COVID-19 spreads so quickly and puts such a tremendous strain on our healthcare system that it can break it. In fact, I'd love for these emergency medicine physicians who are no longer working in emergency rooms to come to New York City and talk to the ER doctors that are working on the front lines to see how overwhelmed they were with this apparently mild virus during its peak. Let's move on to the topic of reopening America. These individuals are adamant about reopening America right now because they're talking about the negative consequences that are happening as a result of this lockdown. Social issues like domestic violence and child abuse, patients not being able to get care because they're worried about getting sick with COVID, routine procedures being rescheduled, economic harms. All of these negative consequences are very true, and we need to take them into consideration when we're weighing the benefits versus harms of a lockdown. The last thing we want to do is to rush to reopen America haphazardly and see a spike in the resurgence of COVID-19 cases, possibly destroying our healthcare system, potentially putting thousands if not millions of lives at risk because they might not be able to get care at a hospital. Look, we absolutely need to start taking steps in reopening America. If we continue this for much longer, there's going to be limited benefit and more harms being added on. But the way we do this is strategically. We open certain areas first and we continuously gather information to see what impact we're having on COVID-19 numbers, and then use that data to gradually reopen the country slowly, carefully, and most importantly, safely. At the end of the day, no one benefits from keeping America closed. In fact, this whole theory of politicians keeping America closed just to keep control over the general public is nonsensical. They're getting hurt by this too, and so are their families. If you're gonna be a public-facing medical professional that goes on to talk about COVID-19 and say that you're talking about science, at least do it accurately and keep the politics out of it.